Are you one of many people who have problems with joint mobility or joint discomfort? Most doctors will tell you that it's not possible to rebuild your joints. They'll instead only help you to deal with symptoms. My husband, for example, had severe discomfort in his shoulder. He wasn't able to lift his right arm without the help of his other arm. Doctors told him it was too damaged for surgery and that he needed a joint replacement. He did not want to do it because he would not be able to water ski, and he really loves that. Fortunately, he found a way to solve his problem without medications or surgery, but through suitable nutrition and dietary supplements. Today, he water skis on a professional level, lifts weights, does chin-ups, push-ups, and enjoys his life without any discomfort. Most people, including doctors, do not believe that diet and right supplements can have such a profound effect on our joints, skin, and connective tissue despite the accumulating research. There is a huge gap between the tremendous complexity of the human organism and the rudimentary data on which doctors now base diagnostic and therapeutic decisions. Most people, rather than following numbers of facts, choose to follow that which is authoritative and familiar. In the video below, I review the most common methods recommended by doctors and other medical professionals to deal with joint discomfort. As you will see, most of them deal with removing symptoms or deal with a partial solution, but do not deal with the core problem or cause of why our joints start to hurt. So why not to be proactive about our own general health? Why not learn how to prevent or reverse your problems without waiting for symptoms to show up? And even when the symptoms show up, find out what the reason is and correct the issue instead of just removing the symptoms. Let's now talk about the reason why joints start to degenerate. Collagen and hyaluronic acid are the main components of healthy connective tissue throughout the entire body. When we stop growing at the age 25 or 30, we start losing collagen and hyaluronic acid at the rate of over 1.5% a year. This means we are starting to dry out. Environmental factors like pollution and lifestyle factors such as poor nutrition can speed up the aging process and hurting our joints. Overusing your joints and these competitive sports increase the destruction of cartilage and synovial fluid. To combat this, proper supplementation is critical. Since collagen and hyaluronic acid are the main components of healthy connective tissue throughout the entire body, the supplementation of collagen and hyaluronic acid is essential. There are, however, many collagen products on the market, and most of them are, unfortunately, ineffective. To achieve success, one needs to choose the product that mirrors how our body is built. That means includes the right components in the right proportions for maximum recognition and absorption, and has the correct molecular weight, and disables the enzyme called hyaluronidase that kills hyaluronic acid. When we lose collagen and hyaluronic acid, we start to dry out, and joint mobility and joint discomfort are very common problems. One national study reported that about 1/3 of adults have a problem with one or more joints. Knee pain was the most common complaint, followed by shoulder and hip pain, but joint pain can affect any part of your body, from your ankles to feet to your shoulders and hands. As you get older, painful joints became increasingly more common. And to understand why it happens, we need to know how the joints work. Joints are movable connections between two bones. The joint surfaces of the bones are covered with a layer of cartilage. This layer is between 0.2 and 0.5 millimeters thick and up to 6 millimeters thick on the kneecap. The articular surfaces are separated by a very thin space called the synovial cavity. The joint capsule seals the joint airtight from outside. Cells of the inner joint capsule layer produce synovial fluid. This thick fluid nourishes the cartilage, makes sure that the surfaces of the joint glide smoothly over one another, and acts as a shock absorber by spreading out the pressure put on the joint. Human articular cartilage is built from collagen type 2, 10 to 20%, hyaluronic acid, chondroitin sulfate, and keratin sulfate, 1 to 20%, chondrocytes, 1 to 5%, and water, 75 to 80%. Now, the question is, why do joints start to hurt? The reason why joints begin to hurt with age or overuse is the loss of collagen and hyaluronic acid. Again, as stated above, about 1.5% a year from the moment we stop growing. This means that the joints, connective tissues, and the rest of the body are effectively drying out with age. The level of synovial fluid, which is built mainly from hyaluronic acid, is slowly being reduced. The cartilage became brittle, then thins and loses elasticity. The result is the common bone-to-bone sensation. Moreover, articular cartilage, the specific cartilage found in joints, does not have a blood supply. Rather, it gets its oxygen and nutrients from the surrounding joint synovial fluid. When the joint fluid dries out, there is a very limited supply of nutrients to our joints. Note, all cartilage is never destroyed, but enough is destroyed to cause pain, inflammation, and major discomfort. Now we will focus on medical doctors' recommendations to reduce joint pain. There are several methods recommended by medical doctors to reduce pain and inflammation and preserve joint function. Number 1, medications. All medications, over-counter pain medications, as well as prescription drugs, are aimed at removing the symptoms and blocking the pain, but they will not rebuild or repair your joint. Many have also very bad side effects. Similarly, topical agents may relieve some pain, but they will not eliminate the underlying problem. Using either of these approaches is like driving your car and suddenly having a red light indicating that there is a motor problem, and simply covering the indicator and continuing to drive. The results will ultimately be unpleasant. Removing symptoms without taking care of the cause is similar. One needs to determine and address the underlying reason for the pain and correct it, and not just try to remove the symptoms. Otherwise, the original problem may become even more serious. Number 2, injections. Injections of corticosteroids can reduce inflammation in the lining of the joints and stop the pain. But it is dangerous because we do not feel the pain and the joint can be overused and become more damaged. With injections of hyaluronic acid into the synovial cavity, the pain can be eliminated or reduced for some time. However, neither of these methods will rebuild or repair the joint. The problem will ultimately return. Platelet-rich plasma. Platelets are small cell fragments that release chemicals that induce blood clots that prevent bleeding. Many clinicians have begun using injections of concentrated platelets called platelet-rich plasma or PRP to treat the inflamed or injured tendons, ligaments, muscles, and joints. These methods are not always reported to be successful and are not yet proven. Number 4, stem cells injections. It is possible to collect tissue from one part of the body and transplant it to another part. Bone marrow and fat can contain progenitor cells that can form new tissue, such as bone and cartilage. These cells are often called stem cells. Again, so far these methods are not yet proven and are quite expensive. Number 4, cartilage transplant. The cartilage is grown in a laboratory and then placed in the damaged space. This is promising, but it only addresses a single joint and it's invasive. Moreover, it is still developmental and yet to be fully developed. Number 5, partial replacement. The most damaged part of the joint is replaced, but again, it is not helping rebuild the entire joint and other parts of the joint may be further damaged. Number 6, joint replacement. This is currently a very popular and common choice for treating joint problems. However, it is a radical and ultra-invasive form of treatment, and it is irreversible. When it is done, there is no restoring the joint. Joint replacements are mechanical and subject to loosening, stiffness, complications, and infections. These problems may lead to follow-up surgeries down the road. If it goes wrong, it goes very wrong. It should be used only when there is no other alternative. Joint replacement surgery is generally performed for the late stages of degenerative arthritis, also called osteoarthritis, after other options have failed. Most causes for joint pain can be treated with far less invasive options. Number 7, exercise, physical therapy, and lifestyle factors. It is important to keep moving and doing low-impact exercises. Walking at least 7,500 steps a day is great. Riding a bicycle and swimming are also excellent. Physical therapy is very recommended. Lightweight training is great and does much to help restore joint function. Some lifestyle changes are also needed, like losing excess weight, drinking a lot of water, cutting back on sugar and processed white carbs, and making sure to give your body good nutrition. And finally, let's talk about natural supplements to rebuild your joints and connective tissue. None of the above described treatment options addresses the fundamental reasons for joint problems, namely natural age-related reduction of synovial fluid and erosion of cartilage from overuse. The simple fact is that with age and overuse, joints lose their lubrication and buffering mechanisms due to a decrease in both collagen type 2 and hyaluronic acid. They need to be replaced in the body, however, getting them back into the body is tricky. Many people ask me, why can't collagen and hyaluronic acid be replenished from food? First of all, today processed food often lack of natural nutrients the body requires for efficient functioning. That's why supplements are required for optimal health. The body requires correct proportions and molecular weights of collagen 2, hyaluronic acid, and chondroitin sulfate in order for them to be absorbed and integrated into the body's chemical functioning. If the body does not absorb and integrate the supplement, it simply passes through the digestive system and is eliminated. Absorption is the key factor. However, naturally occurring molecules of the collagen and hyaluronic acid are too large and heavy for the body to absorb. They simply are eliminated in the digestive process. And remember, it is not what we take, but what our body can absorb that counts. It is also important to remember that collagen cannot be derived from plants. It is a group of proteins found in animals only. So, what are the different types of collagen supplements on the market? Well, there are many collagen supplements on the market from different sources. The anhydrolyzed collagens are totally useless because their molecules are too large for the body to absorb. They pass right through the system. And this is also the reason why collagen and hyaluronic acid cannot be obtained from food. It is like trying to pass a basketball through a fishing net. It simply will not get through. The other type of collagen is hydrolyzed collagen, and most often comes from a cow or pig source. This molecule is still a little bit too large for optimal absorption. The biggest problem, however, is that this source has collagen type 1, and collagen type 2 is really needed to rebuild your joints. And also, there is no hyaluronic acid or chondroitin sulfate in the source. Because of these deficiencies, this source is not effective in rebuilding our joints or our connective tissues. Another type of hydrolyzed collagen comes from eggshells and fish. It contains collagen type 1, not the required type 2. The other two required components, hyaluronic acid and chondroitin sulfate, are low in concentration and not in the correct proportions or molecular weight necessary for absorption and assimilation into the body. Finally, recently a new collagen source for rebuilding joints, bones, skin, and connective tissue has been discovered. Its efficiency has been proven in randomized, double-blind, placebo-controlled clinical studies. The results are so unique that it has been awarded 7 US and international patents. There are no other products, even pharmaceutical ones, that have shown similar results. It is manufactured in the USA in an FDA, NSF Sport, and CLP GMP certified facility. It is a total breakthrough. It is clinically proven to improve joint mobility, reduce discomfort, and promote healthy cartilage and connective tissue, and as a side effect, it hydrates your skin, repairs tissue, and reduces wrinkles and deep lines from the inside out without injections, surgeries, or creams. It also disables hyaluronidase, a substance that destroys hyaluronic acid in your body. It helps all joints and connective tissues in the body, including the eyes, gums, skin, nails, and hair. In conclusion, the best way to avoid joint discomfort is to prevent it. You can do this with proper nutrition, supplementation, and moderate exercise. When we stop growing, we start to lose collagen, hyaluronic acid, and chondroitin sulfate in the rate of 1.5% a year. These elements are the main components of our joints and connective tissue, so we start to dry out. When we lose hyaluronic acid, we lose synovial fluid in our joints, and our cartilage start to deteriorate. To prevent this, we should start using supplements even before we start to feel discomfort. Most people, including doctors, do not believe that diet and the right supplements have such a profound effect on our skin, joints, and connective tissue, despite the accumulating research. There is a huge gap between the tremendous complexity of the human organism and the rudimentary data on which doctors now base diagnostic and therapeutic decisions. Once the joint starts to hurt and we try to control the pain through medications and/or injections, this may lead to greater deterioration. Fixing one joint by using stem cells, platelet-rich plasma, or a cartilage transplant technique can help, but it will not solve the problem. We still need to provide the right nutrients to our body so that the other joints and connective tissues remain healthy. Joint replacement is an invasive treatment and it's not always successful. It should be considered as a last resort when everything else fails. Even after surgery, we should replenish missing nutritional ingredients through proper supplementation to make sure that other parts of the body and connective tissues will not deteriorate. Choosing the correct supplementation is essential, since it is not what we take, but what our body absorbs, which is important. It is necessary to pay attention to the source of our supplements, the correct proportions of ingredients, and the rate of absorption. It is also better to take them in a liquid form, and best if they do not need to go through the digestive system, rather that they are absorbed directly starting from underneath the tongue and the mucosa of the mouth into the bloodstream. For a free health coaching assessment and recommendations on what would work best for your unique body type, visit our website at bewellfeelgreat.com.